All the surgeries are done at Roger Williams Medical Center because this is the center of excellence, and we have to do them here, and we want to do them here because all the equipment is here, and that's the center of excellence. All the surgeries are done with something called laparoscopic. That means you're going to have general anesthesia, you will be asleep, and then we usually use 5 small incisions. Okay? 5 small incisions. Most of them are 1/4 of an inch. They're 1 or 2 or 1/2 an inch big. They go a little bit zigzag across your belly. So 5 small incisions. And then we do all these surgeries. There's 5 for the bypass, the sleeve, and for the band. So the band is a procedure that's been around for a few years right now. And this is actually the actual band. This is how it looks. This is a normal size. The band is a silicone ring, solid silicone, with a balloon on the inside. And the balloon is attached through this tube here to this something called a port. And the way this is organized is the port is underneath the skin in the person. I put them on the right side, and then the band goes around the stomach on the inside, like in this picture. And it's at the similar location where we make the pouch for the gastric bypass. So the idea with the band is that once the band is in place after surgery, we leave it there for about 6 weeks to heal in, and then when a person comes to the office, what we can do is, in the office, we can take a needle and find that port underneath the skin here, put the needle in there and inject some fluid into that port, and the fluid will then fill up the balloon here. So it's almost like a belt going around the top part of the stomach. And by filling up the balloon, we tighten the belt. And when, just like any belt, if you feel the belt here, you squeeze it, you just don't want to eat anymore. And the same thing happens here. When that belt is squeezed tight, you can't eat much, because when you eat something, the food will go in here, and then will sit here above the band and can't get through. It needs to be liquid, turn into liquid first before it can go through, and then into the rest of the stomach. So the idea of the band is to simply limit the portion size of a person. So the amount of food will get less and less. That sounded like a good concept, so we used to do a lot of bands for a while. I think I looked at my numbers. I've put in like 500 bands so far. But that was years ago. Since then, we found that the band works great for some people. I have people who've had the band years and years ago, 6, 7, 8, 9 years ago, and they're extremely happy with the band. They've lost 150, 200 pounds sometimes, and I don't see them ever again because they're doing so well and they don't want to come back, and they're happy with their band. Unfortunately, that's not for most of the people. Most of the people, they had the band, they lost a little bit, maybe a little more, and then gained it back. Some people have a lot of problems with the band. It gives them pains, it gives them reflux. The band can move, it can slip. So we've actually removed quite a few bands and then changed it over to another procedure. So on average, we think that about 1/3 of the people who have the band have to have the band removed at some point and turned over to another surgery. So that's why most people in the United States don't even offer the band anymore. I still feel that very rarely there is a person who is really a good candidate for the band, and I might do it. Last year I put in 1 band. This year I think it's going to be 3 bands. So it's really a small number anymore at this point. We don't fill the band until 6 weeks. So for 6 weeks, the band is really not working much for you. After 6 weeks, we fill it, and then you lose weight a little slower, like 1 pound, 1 to 2 pounds a week on average. And some people lose well, and some people don't. Everybody is a little different. The only big difference is with a bypass and a sleeve, everybody loses weight. With a band, not everybody loses weight. Some people lose a little bit and then never anymore. All right, so the band also has same complications as with any surgery, bleeding, infection, and so forth. We talked about the slip, the erosion, the stretched out esophagus, the reflux, need for another surgery. As I said, at least 30%, 1/3 of the people need their band removed because of the problem. And everybody with surgery, even with a band, can have blood clots. So it looks like an easier procedure, has similar risks, and particularly that taking them out after a while, that's one of the downsides.